And we're live.
We're live?
Yes, we're live.
Okay. It is 5:36 and this is the July 13th audit committee. No, actually, yeah. Wait, what is today?
13th.
Monday.
This says Wednesday, July 13th. We're probably gonna have to correct this agenda. This Monday, July 13th audit committee meeting.
Yes.
I will go ahead and call this meeting to order at 5:37 p.m. And let's go ahead and just go down the line to account for who is present at this meeting. This is Melissa Link. I'm the chair. We have auditor Stephanie Maddox. We have committee member Commissioner Patrick Davenport, committee member Russell Edwards, manager Blaine Williams, committee member Commissioner Wright. And we have our Office of Operational Analysis intern. Can you, Aaron, is that your name?
We have Aaron Court and
we
Sarah
have-
Dryden.
It's Aaron Court and Sarah Dryden. Welcome, y'all. Thank you for being here. We have on the agenda number one.
And Ovita's here.
Oh, Ovita, your box didn't show up. Ovita Thornton, Commissioner Ovita Thornton is here. Is anybody else out there that we need to?
Commissioner Link, Deborah London, Assistant County Manager.
Okay, Deborah, thanks for being here.
And Josh Edwards, Commissioner Link, is here as well.
Okay, great. Thank
And Keith
y'all.
from SPLOST.
Is someone else is there?
Yeah, I believe Keith is on from SPLOST.
Keith on? Keith, are you there?
Sorry. Yeah, I was just listening. Sorry.
Okay. All right. Okay, we have Keith Sanders from our SPLOST office. We have our first agenda item is approval of our minutes, which we had some issue with the minutes because of technical difficulties. We had some crash and we're offline a bit for our last meeting. So there's Auditor Maddox, can you explain that? And we might want to delay approving the minutes till we have a more thorough accounting of them because they're not in our packet from what I can see.
They're the very next page.
Oh, okay, I see them. Okay, there they are.
But I will share just as Commissioner Chair Link stated, at the very last meeting, we had several interruptions with technical difficulty that the Public Information Office was unable to figure out. And so they came into our office, mid-meeting. And while you all did not see it because I didn't have a camera, they were trying to figure out the issue. They were seeing something different on their side that we were presenting on our side. And so we went through different measures to try to fix it. And then I ultimately had to just totally power down. There were several disruptions, at least 3 or 4 throughout the hour's meeting. And so I did not do a great job of collecting a lot of notes. And very next morning when I came in, I spoke with staff to kind of get an idea of what we could remember. And so I'm not certain if we've captured everybody that was on the call last month, but I want to ask if there's anyone that is missing. If that you know about, please let us know. We will amend the minutes to update that. The other issues, if there are any items of discussion that is missing, if you could please let us know that as well. We will revise the minutes and present them at the next meeting.
Does anybody have any amendments to these minutes? Anything?
Melissa, this is Allison. I don't have my audit folder with me due to traveling. And so I kind of like your first idea where you said, let's put approving these minutes to roll it to the next meeting, because I have my notes to, we've had many discussions about making sure the minutes were meaningful and had details And so, and I really appreciate the way the minutes have been meaningful and informative. And I think that we may be able to supplement.
Okay,
I
that's
can't with my
like a reasonable request. And if anybody does have notes, I checked to see if I had any, and I couldn't find any notes that I took last
Yeah.
week.
But I'll put that on my list to look into, and then I can and I'll send that in as far as being able to supplement the topics.
Okay. Yeah, if anybody does have notes and can submit them, go ahead and submit them to the whole committee and Auditor Maddox, and maybe she can supplement them and we can take a look next month and approve them next month.
Okay. Thank you. I appreciate that.
Or have as thorough as possible minutes for that meeting, especially considering the recording was disrupted a couple times.
Mhm.
Okay, let's move on to our next agenda item, our work plan activity update. Stephanie, you want to go ahead and give us an update?
Sure. So we have 2 remaining audits that are outstanding. That is the Fleet Management Program audit. And currently we have 1 interview remaining with the director. There's some new information and updates that we would like to include that he's been working on. And we would like to include that information in the report. And we are still on track to complete this report by the end of July this month. For the Animal Services Department, since our last meeting, we've conducted over 35 interviews with stakeholders and went out on 2 field observations. So we've been really busy. We only have 1 interview remaining, and we plan to continue with our scheduled. I'm sorry. We plan to also. I'm losing my words here, but we plan to also complete this draft report by the end of July this month.
Okay.
So by the end of July this month, we hope these 2 reports, a draft report will be submitted to the departments.
So as of the end of this month, y'all have a clear slate.
That's correct.
Okay.
Melissa,
Yes.
just a point of order. It sounds like at the end of July that both of these will go for a 30-day to the drafts, right? Go out. And then after that 30 days, it comes back for them to, what is it, Stephanie? Fold the information in? Yeah.
Incorporate the responses, correct?
Yeah. And then
manager's office, the department, into the final report.
Yeah.
And that's about a 30-day process turnaround time for both reports.
Okay. Let's move on to a discussion of the inmate medical services audit.
Madam Chair, do you have any objection to
read
skipping
the
over?
document?
I'm sorry.
Yeah, I just want to make sure everybody has had a chance to read the document. And actually, I want to say thank you. The document looks really good. I know you guys are. Is this a result of some of the new software, or has that software come in yet?
It has not, and I have an update for you on the software.
It's a very clean document.
We're working hard and trying to improve the presentation.
Yeah, the presentation's really good. I noticed a difference.
But Madam Chair, may I please ask if it's possible to skip over the animal services review to go to risk assessment and come right back? Because it's going to be a short update on risk assessment.
Okay, you mean the inmate services? Yes. Okay, sure. If you'd like to, change the agenda.
Sure,
order,
just move those 2 around.
To D, risk assessment, and come back to the report, the audit report.
Okay. I just wanted to share with you all that since our last meeting, we did reach out to all of the departments that had not responded. And so out of the 117 auditable areas across 38 departments, we did receive responses from 108. So that was a 61 response in number increase so from 35 out of the 38 departments, which is really impressive. There are a couple of departments that have logistical challenges, and I wanted to highlight those for you. They're not necessarily late, but they have a lot on their table, and that is the attorney's office and the magistrate court. We've just given them more time because of the workload that they are facing right now. We're still waiting to hear back from a few departments, the Central Services Departments, Clerk of Commission, Housing. There's only one division under Housing and Community Development and 2 under Human Resources and the Mayor's Office. But outside of that, we have a great response, 92% response rate, and we're pleased. We are collating the information right now and preparing it in a report format that is that we would like to present to you at the next meeting.
Great, thank you. Okay, do we want to go ahead and move on to the inmate services?
Mhm. All right.
Can I ask a question, or is it too?
Go ahead.
So I just want to clarify to make sure that, so over the past 9 years, there were 2 contractors for, contracts sent out for, inmate services, but it just seemed like there was a blip for 1 year in FY17. Did I have that correct?
Well, in FY17, it was actually, so the first initiation of the contract was from FY12 to FY16, and that was a total of 5 years. At the end of the 5-year term, the Sheriff's Office had to rebid the project. And so another company came in with a lower bid, and that was Correct Health for FY17.
For just 1 year?
It
Am I
was
missing?
for 1 year, and they had similar contract terms, which are the option of 4 1-year renewal periods. However, in January of the next fiscal year, well, 6 months into that contract with Correct Health, the Sheriff's Office decided to rebid the project.
Okay, so there's an error in the reporting then, unless I'm reading it wrong. If you go to page, under the executive summary on page 2, if you go to the background, to the second paragraph, and maybe I'm reading it wrong, and it quite possibly I could. Just the second from the last sentence, Correct Health submitted a bid and was awarded the contract in January 2017. The Sheriff's Office again advertised for an inmate. So, the prior sentence was at the end of the contract period of Armor, the SO advertised for inmate service to begin at FY17. So Correct Health got it in 2017. So you're saying the Sheriff's Office just immediately went ahead and did another bid as soon as they got the contract?
Well, no, at the end of the contract period for FY16, and this can be clarified, it's basically stating that at the end of the contract period, they sent out the project for another bid, and Contract Health actually submitted a bid for the FY17 fiscal year.
So I think, Patrick, I can clarify this. January 17 is in the middle of FY17. So them bid advertising for a new inmate healthcare services contract is still in the middle of FY17. So it was the FY18 year.
Okay.
Is that correct, Stephanie? Is that how I'm interpreting it?
Yes, that's correct, and I apologize.
You might want to clarify that, just saying, adding inmate healthcare services for the FY18 contract or something. Just stick it in there, so because I can see how that is confusing because people don't understand that FY17 is actually July 16th.
Yeah.
July 16th through June 17th.
Thanks,
So, yeah,
Patrick, for bringing that to my attention. All right.
Thank you. Thanks,
Absolutely.
Patrick.
No problem.
Okay, so our task was to review the contract compliance with the current contractor, which was Armor Correctional Healthcare Services, Inc. And what we started with was just an overview, a high-level overview of the contract agreement and its terms. And then we went next to looking at the expenditures that came in on an annual basis and the categories that they commonly fell in. And that's where you see that table where we break out the high cost areas. You know, for finding number one, the recommendation that we made was for the sheriff's office to consider employing a clinical contract manager, someone that has experience with oversight of medical billing as well as medical, and it has familiarity with medical terminology that could not necessarily babysit the contractor, but provide oversight of the contract provisions. Are there any questions so far? Hello, can you hear me?
Yes.
Okay, I don't know if there are any questions. So we thought this finding was important because, you know, there were some unexplainable discrepancies in the billing. There was some double charging that was actually caught and reimbursed. And there were some numbers that were presented to us that were either incomplete or different from what we received from another source. And so as a contract manager, we thought this person would be a dedicated person with sole responsibility of oversight of contract compliance. Additional benefits of this position would be an individual that would be available to go out into the community and to develop partnerships and negotiate healthcare rates with local medical providers, with the likelihood of receiving more favorable price healthcare services. And also, and more importantly, what we notice year after year after year is that at year end, there are tens of thousands of dollars that are transferred into this account to cover the shortfall. And we feel a healthcare contract manager would be able to not only examine and make sure that the current fiscal spending is accurate, but also be able to provide some oversight and forecast future spending based on the estimated overages that they are going over on an annual basis, so that they, when they present to their budget or request their budget for the annual budget period, it's more realistic to what their needs are, and it doesn't appear as if, you know, they're at the last month of the year transferring several hundred, tens of thousands of dollars just to cover the shortfall. It's more, the idea is to be more proactive and develop local relationships with healthcare providers and to help with fiscal oversight, and if there's any savings to be had, to assist the sheriff's office in doing so.
I have a question about, I wrote down some notes. The 270-day period that the contractor has to bill after the fiscal year is over, the sheriff's office states that that's not unusual. That sounds unusual to me, and it sounds unreasonable. Whereas, you know, the contractor can dig up bills from last year up to 3/4 of the way into the following year, while the sheriff's office only has 30 days to respond to them.
Yeah.
And I noticed you posted something about from a contract from Minneapolis that has a quarterly period where they're required to follow up on those invoices. By saying that's not uncommon, how not uncommon is that?
It's not common. It's common for Armor to start here with their contracts. And we did a full contract review, just a query on specific data to yield all of the sheriff's offices that work with Armor Health, and to determine what the aggregate spending limit was, and that time period for the claim period. And so there were some agencies that we saw where there was no time period. Some agencies reported 30 days. Some agencies reported 90 days. And there are a lot of agencies, truthfully, that do report 270 days, but it's not reasonable. And following up with the finance department, you know, the first thing I thought about, just being a former employee of finance, is that allowing a payment of an invoice 270 days into the contract actually it takes the payment into the next fiscal year. But I wanted to just confirm that my information or what I was thinking was correct. So we reached out to the finance department, and they also agreed, and they were quite surprised. They would prefer if they had any, if there was any way to make a suggestion that would be accepted, they would prefer that this is reduced to 90 days. Because if you all remember, our external financial auditors come in the month of October, and if to analyze the fiscal health of the entire organization. Well, if the sheriff's office is open to still receiving and paying invoices past that time period, it's just not counted in that figure, or their numbers. And so the finance department felt very strongly that 90 days was more than appropriate.
And can you just quickly explain what aggregate claims mean? Not sure that term is familiar.
So aggregate claims is a term that they use for any amounts over a cap that they are willing to cover. So in the contract, they have their compensation base period, the compensation base amount that they're paid. They also state that for hospitalization and for specialty care, they will pay for claims up to $150,000. Now, any claims over $150,000 fall into the aggregate claim category.
Okay.
And so they want to be reimbursed for that. And so they are to present invoices regularly to the sheriff's office so that they can be reimbursed.
Okay. Okay. Thank you.
Mm-hmm. Any other questions so far?
Go ahead.
Okay. So. Now we list here some benefits of the clinical contract manager, and I think I mentioned most of them, but if you can see the table at the bottom of this particular slide, there was some significant discrepancies as it relates to the average daily population for inmates. And their contract is there's a portion of their contract that is dependent on a certain number, or staying under a certain number. And if they go over, they're charged a per diem per inmate. And so we received data from 2014 through 2018, and some of the data was incomplete, and that's one issue. The second issue is in comparing the data numbers that are listed from the sheriff's office, we then compared those to the expenditure detail reports that are on our Eden financial system that identifies in each individual month if there is an overage in population. The numbers that they are charged for are even different from the numbers that they turn in to the sheriff's office. We were really confused about what to count as an accurate ADP number. And so we reached out to the GBI. They are responsible for collecting monthly reports from every sheriff's agency in the state of Georgia, and they are self-reported. And so as you see, there are two lines. The first line represents the number of inmates per month, by month, based on what was self-reported by the sheriff's office to the GBI. The second line that starts with 436 is what was submitted to us by the sheriff's office. And there are differences in almost every month.
Stephanie, is looking at other places to get information like GBI department, is that customary, or is that something that you have just, would that be in every audit report, or is that something that you've identified as a resource?
I tracked them down as a resource. I reached out to a couple of other agencies and learned that all sheriff's offices self-report their numbers on a monthly basis. And so I actually called first and I spoke with them, and they had up-to-date numbers, through last month. And so they were able to help me fill in the gaps of information we did not have. And it was a combination of reaching out to other agencies to find out how, do they also self-report and how that works, and as well as having a conversation with the GBI as well as the Department of Community Affairs. The GBI actually forwards their report to the Department of Community Affairs to publish to publish on their webpage. They have a public safety webpage, and so the GBI publishes this information and then submits it over to the Department of Community Affairs. So it was a little of research and reaching out to other agencies.
Thank you. Thank you.
Thank you.
Yes, ma'am. So these numbers are very small, but the takeaway is that they're inaccurate. They're not lining up. And again, it's just more. This just strengthens the finding for number one. A contract manager is not to babysit the contractor, and I kind of think maybe it was, the finding was received that way, but it's not. That's not the purpose of this position. This position is more so to make sure that the terms and the provisions outlined in the contract are being followed, and to provide assistance where needed. Someone that had responsibility of that role could possibly have caught this discrepancy earlier. Okay, go to the next slide. The next finding, we only had 3 findings. The next finding was that the inmate language in the contract we felt was unclear. And the sheriff's office disagrees with this finding. And the major issue is that from contract year to contract year, there were increases in the contract base price that were, I guess, unexplainable to the public, or there was no justification provided in the documentation why there was a significant increase from one contract year to the next. We compared the FY16 contract to the FY18 contract, so the FY16 was the end of one contract period, and the FY18, the contract, was the beginning of year 1 of the new contract period. And between the 2 years, there was a $313,000 increase. And the only thing that we could tell that was different was just a slight increase in staffing. Well, we met with the attorney's office and had a few appointments just to clarify, you know, how often are they seeing contract amendments, revisions, or changes. And generally speaking, they see the original contract, but if there are any revisions or extensions, that is pretty much handled through the purchasing division. And if there's a price increase, they would not have the context to question it. And so it just appears to be a loophole it's not addressed. Like, no one is asking the question, why did the contract increase so significantly? And there may be valid reasons, it's just not anywhere in the paperwork or the documentation. Any
I have
questions?
a quick question. One of the things that's mentioned is the pharmacy costs. I'm just curious, was there detailed information on the invoice, on the pharmacy invoices, as far as like the types of medications? Or was it just an overall bill? Was there any line item documentation?
It was just an overall, like one line item invoice that was submitted at the end of each contract year for payment. And it was usually in the month of June, and it was for a large amount. And so this kind of ties in with the next finding. But
that cost goes down. The pharmacy cost seems to go down while the overall cost goes up, and it doesn't seem to parallel the inmate population really. And the sheriff does specifically mention the cost of HIV medication, and it just rung a bell in my head from my earliest days on the Board of Health about 5 or 6 years ago. We had heard some concerns about HIV positive inmates not getting appropriate HIV medication. And we've also had some discussion about mental health medication and that not necessarily being available to inmates. So I'm curious to know, why these pharmacy costs, overall costs, are going down, and what particular meds are not appearing on it throughout this period. That wasn't part of your documentation.
Aaron, do you happen to have that spreadsheet, that table pulled up that is presented, that Armor prepares?
Yeah.
There's a report that Armor prepares, they're supposed to prepare on a monthly basis for the sheriff's office. It's part of their, can you increase it a little bit? Or can you all see that?
Yeah.
Okay. So this is a typical template report that Armor prepares for every agency that they work with. And Aaron and I were talking about their healthcare costs. Aaron, if you want to go into what you learned about the AIDS medication or AIDS patients.
Yeah, sure. So in their response, the sheriff's office had mentioned that HIV medication was a big driver of costs, and that it is expensive and it varies from month to month depending on the inmate population. So we did a little, collating of data, and in this table here, just to take a look at the average number of inmates that are reported as having HIV. And it seems fairly static. You can see that it will vary a little bit more month to month when you sort of go down to a lower level of a lower time level of view, but it's fairly consistent year to year. So that was something that we were maybe a little bit more curious about, and we're hoping to get more information on, because it doesn't seem as though HIV medication, unless there was some other factor as to maybe the change in brand of medication or change in supply chain, something like that, that would be changing price. But based on what we see here, it's not particularly telling as to how the pharmacy costs are changing down here.
Thank you. That's helpful. I was curious about that.
Melissa, this is Allison. I have a question while this awesome information is on screen. Can I ask a question?
Yeah, go for it, please.
If you guys would scroll left so I can see the different, I had just written a note down that I was interested in reference to finding 3 where it says invoices submitted for payment lack sufficient detail. Can you scroll down? I would like to see what the categories of, this looks like categories of invoices. Is that accurate?
Where is that at?
Right? So these are categories that of medical care related to what has happened in our town.
These are the numbers that the contractor that they capture.
Right? And so this is in reference to invoice details, right?
Not necessarily. I don't see invoice details. It's more so the number of visits or exams, the number of prescriptions
So there's no
administered.
money attached to this.
Okay. All right. So let me not try to put the 2 together. Let's just go with these. These are categories. Let's scroll down to the bottom. I want to get to the ER area. Some of these are sort of maintenance mode. I want to know off-site. So when these hospital ER visits, this tells me that there was an incident or an accident. So if it's an ER visit off-site, I guess, can we get a copy of this sent to us, please?
Yes, ma'am. Absolutely.
Yeah, I think I had written down the question about the offsite thing too.
So I think at this point, if we just have this, I can have a follow-up conversation at another time. You follow me, Melissa?
Yeah, I mean, it'd be really helpful if we could get this spreadsheet. That it sounds like you guys just got a hold of this in response to the sheriff's response. Is that correct? Or you just kind of
more completed? There were some that were half complete, so we had more completed.
So y'all pulled this together, this data sheet.
Well, no, we actually used what we could, and then we went to other resources for the high level data like inmate count and whatnot. But we did reach back out to them for the additional, like there were half of the year was blank, and so they were able to provide some additional information for some years.
Okay, so so let me go back to the title of this is multi-year 2015 to 2018, but yet we've got 12 months. So you're telling me this is 4 years and it shows us which numbers are happening within the months of the year?
It should.
Okay, so the title of the document says 2015 to 2018. It looks like it's more accurate to say that it's 27. Oh, there we go. There's more. Okay. Yeah, if you would send us this document, Melissa, I think that if I just have some time with this document, I might be able to better follow up with my question.
I think we need to clarify on the left, and Erin, correct me if I'm wrong. On the left is a data that was presented. On the right is that the next fiscal year, or is that data that we worked on?
So we had reworked the data. They gave it in a calendar year form. So the data reworked in a fiscal year form on the right side. So this would be, if it's calendar year fiscal, it would be fiscal year 15, I believe.
Well, I can follow it now that you've scrolled it. And I guess that's why I think if the committee could get this complete document, we'll be able to see the year, months, but also the different categories. Cause that was one of my questions coming into this was how they're categorizing the care and seeing the offsite and the emergency room stuff. That helps me in a area that I have more questions. Okay. Thank you.
Thank you. Yeah, this is helpful.
Okay. All right. Last is finding 3. Okay, so finding 3 was simply just a note that states invoices submitted for payment by the contractor lack sufficient detail. And so I do have an update. After we presented the draft, during the draft phase, the sheriff's office did provide us with sufficient information that proved that they actually received invoices that are broken down by area and criteria. They are just not submitted with the invoice for payment. And so the statement of services, we were told by the sheriff's office is maybe we have them and we submit them to the finance department, but maybe the finance department does not upload them to the Eden financial system. And so we verified, we had another conversation with finance just to find out exactly when they receive an invoice for payment from the sheriff's office, what type of detail comes along with it. And the answer we received was usually it's just a 1-page invoice that states something very simple like pharmacy costs for fiscal year 17, something very simple, and it'll have just an aggregate total for the full year. And there are usually 3 signatures and that's it. But what they provided to us, they have detail, itemized detail that lists, you know, when pharmacy payments were made or whatnot. And that original finding, you know, was changed to state that the audit team did not find any evidence that the contractor included supporting documentation when submitting invoices for payment. It is, it's the expectation in the finance department if you have it. And so I'm not sure why they're not including it, but it's, that's where that initial finding came from. And the recommendation is if they have the backup documentation, to just go ahead and include it with the invoice for payment, and finance will process it from there.
Okay.
Any questions, you guys?
Is that type of payment typical through with other departments?
Which type of payment?
Excuse me.
Like to provide backup documentation?
Yes.
Yes, it's that's what I wanted to just verify if policies had changed, and they confirmed with me very strongly that the policies had not changed. Whatever you have that justifies the invoice or supports the invoice that a department is submitting for payment, they want that backup detail. And that is what I am accustomed to, and I am used to. Even with our purchasing cards and travel cards, we have to submit our detail. And so they have not been doing so.
Okay.
And so I actually changed the finding to reflect that, you know, there's no evidence yet, but you know, I did include in the report an update that says that they do indeed have the documentation, they just have not been submitting it to the finance department.
Stephanie, I guess my question is in the same vein. When the invoice, and I think Chairman Link alluded to this. So when we have these medications, they are not itemized. We do not know what the medications are. There's no record of itemization of whatever the medicines are. Is that what I'm hearing?
I have not received an itemization of medications per se. What I have seen is an itemization of pharmacy costs per month. They were able to provide the pharmacy costs like broken down by month, what they paid to their vendor. But you know, I think for future planning, I think it would be wise to actually list the pharmacy medications by class. I don't think there's any benefit to having any more specific detail than that, but if they could list the pharmacy medication by class. For example, cardiovascular medication, antiviral medication, oncology medication. I just think having those high level labels would help them, you know, plan their future expenses if they know they're going to have, if they have a large proportion of their inmate population that is taking a certain class of medication that is expensive. I think oncology and antiviral are expensive. I don't think cardiovascular medication is expensive, but it would be nice to have that level of detail. I think the particular medication name, I don't think there's any value in that per se, but I do think there's value in breaking out their pharmacy costs by class of medication.
I wonder if there is value in stating the brand name of the medication, because there can be a vast cost differentiation between a name brand medication and a generic brand. And I know that in the medical industry, there is a lot of room for abuse when it comes to prescribing name brands over generics when they can do, basically do the same thing. So it might be helpful to ask that.
I will follow up and ask.
Yeah. I think that, I know that's an issue in the insurance industry and in some practices.
One more question I have, Stephanie.
Yes, ma'am.
And what's the name of was it Amera? What's the name of this vendor? Amera.
Armor. Yes, ma'am.
Where are they located at?
Their home office is based out of Miami. And my research suggests that they have over 150 jail contracts throughout the nation as of last fiscal year. And it's in the top 5 for serving jail populations and their medical needs.
So clearly this is a business that is privatizing.
Yes.
You don't have to answer that.
You mean the jail in general, the fact that there are private companies performing these services for inmates? Is that what you're?
Yeah, that's what I'm kind of I'm circling the wagons around. I know that's not a conversation for today, but I do think it's a conversation in the future.
Okay, yeah. I thought you meant something else. Okay, I see.
Yeah, because at some point you do list all the different contracts that the sheriff's office, all the private contracts, or I guess the response lists that. Mm-hmm. There's a long list of private contracts that this recommended contract manager could tend to, and that it would just be interesting to look at the overall costs of each of these contracts and how much of our jail budget actually simply goes to private contractors. And, that's essentially privatization when the vast majority of your budget, your publicly funded budget, is going to private industry. Yeah, I do get where you're going with this, Commissioner Thornton. It is something to be very concerned about.
Overall, I will say we didn't see any overt incidences of non-compliance. However, there were many areas that would benefit from improvement. I do strongly believe that a contract manager would provide a tremendous value to the sheriff's office in fiscal savings, fiscal oversight, future planning and budgeting. It would eliminate that end of the year, transferring $60,000, $80,000, $90,000 just to cover the shortfall. It would help them plan more efficiently for their medical costs. And this individual, I don't know if they're like the police department, but so I don't know if they have any preferred healthcare rates out in the local community. But this individual could be someone that can seek those out and develop relationships and try to establish some relationships that would yield a discounted price, a healthcare price for the sheriff's office expenses.
Thank you.
Definitely thank you from me also.
You're welcome. Thank you. Any other questions or follow-up questions for me to the sheriff's office?
I don't think so.
Commissioner, Chairman Link, as we're receiving this information, is it proper protocol to be able to make recommendations before or by the time it goes to the full commission? I know there's still a lot that we have to learn and be, you know, educated on, but are there recommendations that will come from this committee, not from the audit department, to address cost, privatization, and the health care of our inmates?
Well, seeing that the sheriff's, and I don't know if we have an attorney on the line, but the sheriff's office is an independent elected official. So, you know, technically we cannot make, I mean, you know, nothing hold them to any of this, but we do have some purview over the budget. And I feel like this is the kind of thing we need to consider when we do take a look at that budget. And certainly when the mayor and the manager are pulling together the budget, this is kind of information should be taken into account. And we'll have a new sheriff coming in next year, and I would hope that we would have an opportunity to meet with him and raise these concerns. I would think that would be a proper procedure. So maybe we can make that request of the mayor, that we, request a meeting with our new sheriff and bring up some of these concerns that he can take into account moving forward. I don't know if anybody.
Thank you again, Chairman. That's kind of where I was kind of heading to.
Yeah. So maybe it's up to all of us to, state these concerns to the entire commission and to the mayor and make that kind of request, that we have that dialogue with the new sheriff and that we bring these up at budget time.
I don't think and if budget is all that we have control over, I don't think we can overlook these findings without a plan moving forward. So if the budget is our hook, then we probably need to prepare for those conversations. It might be even good at our retreat, Madam Chair.
Yeah, I agree. This is the kind of thing that we would definitely be discussing in that fall retreat, when we just have the first beginnings of hammering out a budget for the following year. So let's all keep that in our back pocket for this fall. All right. Is there another slide, Stephanie?
Oh, it's just the audit topics for discussion, that we always include at the end, just as a reminder of what commissioners have recommended over the last few years. That the list hasn't changed much. Just as a reminder, what's on the current list, we always leave it as part of the agenda at the end, so you all are aware.
Well, I would like to, discuss possibly adding something else to this list. Especially in light of the conversations we've had just in the past couple of weeks about the FY21 budget. And the concerns we've had from the public regarding the police department's budget. Considering some of the demands that we're getting from the public and from other members of the commission, I think that, and we did vote on a budget that includes significant funding for a public safety and community building task force that will specifically be looking at police budgeting and social services budgeting. I don't believe that committee can function adequately without having the kind of information that an audit would present. So I would like to propose that we add an audit of the police department to this list as it pertains specifically to budgetary and staffing needs. There might be some other things to put into that scope, but that would be something we talk about more. Does anybody have any thoughts on that?
Hey, Melissa, I do.
I do, and well, I'll let Commissioner Wright speak first. I yield to Commissioner.
Well, thanks. I wanted to, just as point of order, we've already talked in the agenda about the risk assessment, and we've already voted as a full merit commission that the risk assessment and all the, what did you say, 108 areas in 35 departments, and we're going to get a summary on that. So we just a reminder, we can't jump ahead and start handpicking areas to audit. The whole risk assessment point that the Office of Operational Analysis is working really hard on is taking the data from the 108 areas and 35 departments and summarizing that for our next meeting. So they're not without anything to do once they wrap up the 2 audits. And then that information is how we plot our next audits. And
Yeah.
I just want to remind you that point of order.
With the risk assessment, go
I
ahead.
I want to chime in there. I understand what Commissioner Wright is talking about, but as we go through the concerns that people have been yelling at, I thought that the chair was trying to suggest that they have all the information as they prod through whatever work comes out of it. I did not see this as for everybody, for everything. I really think that when whoever and however this commission moves forward, that they have all the information that is available. That is what I thought the chair was addressing, which I would support.
Yeah. Well, I go through a little history of kind of where we were before. I mean, we only even voted on the risk assessment as a tool, several months ago. That thing didn't even exist. The long-standing process for determining new audits was a purely qualitative process, which is, and in the debate that we had over, a couple of years as to whether or not to even move forward with any kind of risk assessment tool, was to take a qualitative and a quantitative approach. And the risk assessment would be the quantitative tool, whereas the traditional process that's been the process in the past is, the quantitative tool, basically gut instincts, what we're hearing from the public, what we're hearing from staff, and combining those two. So, I think it's a natural process to hear the voices of the public and others on the commission regarding, police department budgeting and social services needs, and the fact that the commission itself allocated significant funding to address these concerns.
Well,
I think it's a natural process to say, we have this qualitative body of evidence and pleas, and we have a risk assessment coming up that's going to have some quantitative evidence, and we're going to take a look at both of those bodies of evidence for the whole list of departments as we determine where our next audit work plan is going.
I do things in bits and pieces. I think that works for me with what we're going to be addressing with public safety. I do not see the mayor appointing a committee, not having this objective analysis. I'm only talking about the public safety, police, that realm. So please don't understand me, Commissioner Wright. I'm talking about, we have done, or this audit committee has done some objective work that I cannot understand if that is not shared with whatever committee or whoever the committee is appointed to. So please don't make this bigger for me than it is. I'm just talking about what we're talking about with because I'm gonna be honest with you. This is the hot issue right now. Policing, the sheriff, the fund, all of this, that is the issue of today. So I'm not trying to make this bigger. Maybe in other areas, yeah, but I'm just talking about where we are now and the information that we have, which unfortunately most of the community, they don't have. And they're acting on reaction or perception. So that's the only thing I was talking about. Nothing else, nothing more. So let me be clear about that. I'm not talking about any other issues. I'm just talking about policing.
Commissioner Edwards, you say?
Madam Chair, I move to table consideration of our audit plan until the risk assessment comes back.
Yeah, I agree. Yeah, yeah, we certainly wouldn't be considering that until this comes back.
I second it.
All in favor?
Aye.
Aye. Let me look back at
I'll
our.
be down with you on that. Thanks for sharing that.
Yeah, I
It's
mean,
all
I
good.
just
We're all
think
good.
that I just want to add that I believe that in my mind, it was never our intention to use the risk assessment tool as the sole informational body to inform our work plan. There was always going to be that qualitative and kind of changing needs-based element. So I mean, we can have that discussion in the future, but that's where I'm coming from, and we'll see where we are when we get that tool.
Right. We're still going to have to vote for who to audit, right?
Yes, exactly.
Yeah, okay. All right.
And that I think would be a process.
Exactly,
Yeah.
exactly,
We still have to vote.
exactly.
Yeah.
Yeah.
Okay.
And that's
All right,
where
let's
I'm
move.
coming from also, exactly.
I mean, we're just kind of having a discussion about that process, and you know, there's no decision making going on, but I think we do need to have some philosophy, you know, moving forward, and that's something that, you know, we can talk about.
Oh, you got the philosophy covered for sure.
That's kind of my job.
Yeah.
So,
What's
you know,
next?
let's see, I'm got to go back to my agenda here. Administrative updates. Okay, yeah. Chair Maddox, you have a couple updates regarding the management software and the overview commission.
Sure, I can cover them both in about 2 minutes if you allow me that. The audit management software, we've actually completed the process. We've submitted an RFQ. We received three quotations. We set up an evaluation team who evaluated the bids and submitted those to the purchasing division and determined who the winning bidder is. The next step is to prepare an agenda item for this software. The total is, I believe, off the top of my head, around $34,000 just for the setup. And after that, the maintenance has been included in our ongoing budget starting this year. And so that's the quick update with the audit management software.
Can I ask a question before the next update?
Yes, ma'am.
Yeah, can you tell me who your evaluation team was, who that consisted of?
It was Eric Griffin.
Who is that?
He's the treasurer in the finance department.
All right.
Position is treasurer. He also Barry Fuller. He is analyst supervisor in the IT department.
Perfect. That's good.
And myself.
The three of you?
The three of us, yes, ma'am.
That sounds perfect. Okay, thank you.
Absolutely, great. And then for the 2020 Overview Commission, I just want to share with you all that there are some departments that they will be reaching out to. They've had to abbreviate their goals substantially because of COVID, and they're very mindful of the unified government's responsibilities, and they don't want to impede on any progress towards getting back to day-to-day services. So they've limited their list from 44 departments down to 5 areas. And they just have high-level areas that they want to focus on. And they'll be working on that for the next couple of months and beginning their report later this year. Just want to share that with you.
Those areas, do you think you could send us just a little memo that states those, so we have something in writing as to what they're up to?
Yes, I can. I will.
Melissa,
Yes.
I have a question. We had talked earlier when this started, due to the abundance of work that operational analysis is doing, and then the add-on of them working with the Overview Commission. We had asked for sort of some charting or what do we call it? Validation of how much time that committee is taking
Oh,
from
yes.
them. And can we get that in our next summary?
Yes, ma'am. I'm so sorry. You did ask me that from the beginning, and I've actually been capturing that from week to week. And so it's about 2 hours every week.
Okay. And so if it's okay, I mean, for me and the way I'm looking at it, you know, when you have your update chart of the work plan, if maybe we could just add in a chart, if the committee thinks that would be helpful, it would help me, that you would add like the 2020 Overview Commission, and then you would be able to just sort of capture the amount of time. Because if it starts getting erratic or overloaded, I really want to make sure we're on top of that to help you.
Like that table?
Yeah. Does that sound okay?
Is that okay with everybody?
Thank you.
I'm happy to do so.
I think Patrick's trying to talk. I'm going to turn my mute off so I don't interrupt him again. Go, Patrick.
No problem. I'm just trying to, okay, and just correct me if I'm wrong. Why are we updates on the oversight committee, overview committee, when it's independent of the audit committee? Correct?
They'll turn in a report at the end of the year. That's how the charter designates that process.
But that go to the commission full, correct? Not just the audit committee.
Yeah.
It does not come to the audit committee.
The whole commission, but Stephanie, as their kind of liaison.
I provide sole administrative support. I set them up for the WebEx meetings, and that's it.
I just want us to just to focus on what the audit committee, needs to be doing instead of, your outside work. Does that make any sense?
Yeah.
Okay.
Yeah, I mean, and Stephanie, it's kind of your duty to kind of file their information requests to departments. Is that correct?
I do. I submit them right to the directors, and they respond quickly.
And that's where I'm kind of interested in seeing that memo of what those areas are, just so we have a general idea of how it's impacting, your day-to-day work and the day-to-day work of other departments. But I don't need to know their findings or any detail, but if we could just get a general idea, as an audit committee that assigns you work, I think that would be helpful. But at year's end, we'll see what, hopefully will be, an impartial report from a committee that's operated completely independently.
Correct.
One of the questions, Madam Chair, I would like to reiterate and redirect to the manager's office. I don't remember if it was the audit committee or the commission committee. The commission. We wanted to take a look at that actual contract with, what's the name of the vendor again?
Armor?
Armor? Yeah, Armor. County Manager Blaine, can we get a copy of that contract?
Yes, ma'am.
I have the most recent contract, the FY18 with the 5-year step ladder, if that's what you're interested in, or?
If you would send that out to the committee, that would be helpful for me.
Okay. Got it?
Okay. All right. Our next item on the agenda. Well, first of all, Stephanie, I want to say thank you. Thank you to you and to your staff. You have some really talented interns, I understand.
They are ready to go. They're rock stars. They're tremendously helpful. We've accomplished a lot.
Thank you. Thank you, Erin and
Sarah.
Sarah, yes. Thank y'all so much and best of luck moving forward. This is
And I want to add my thanks to also to you, Stephanie, and your staff. I know that you have been short departmentally.
Mm-hmm.
You have really touched those levels that we needed. So I want to also say thank you and continue the good work.
Yeah.
Yeah.
Yeah, this is a
Thanks,
really
everybody.
good looking document.
Yeah.
It's really
Yeah.
easy to digest. So I commend
Are
y'all.
we adjourned?
We
Thanks,
need to
everybody.
decide when our next meeting is. Are there any travel plans for anybody that would, I know this might be the time of year that folks are hitting the road. So we need to work around that. Does anybody
Yeah,
have?
there's a pandemic though, so maybe not so much, right? COVID.
I don't know. I traveled to get away from the pandemic and came back and it was even.
Yeah.
So I've got us down as August 12th.
Yeah,
August
I mean, does
12th is our
anybody,
next
Stephanie, do you have any?
Not that I'm aware of.
Yeah, I mean, typically we want to do that second weekend, that second week of the month, make that agenda report for the following month. Does anybody have any objections to that?
No, that works for me. And because we're in the pandemic, I am more flexible actually to make sure I can dial in even when I am traveling. Or in my
Yeah,
case,
well,
I'm quarantining. So yeah.
And it's 5:30, correct?
Yep.
5:30. Do we want it the 12th?
Yep. That
Is
works.
that okay, Stephanie? Does that work for
Yes.
you?
Yes, ma'am.
Okay.
Great. Thanks, everybody.
All right. Okay. Well, I'd like to go ahead and entertain
Move to adjourn.
I second it.
all in favor.
Bye.
Aye.
Okay, it's 6:48 p.m. Commissioner Edwards motioned and Commissioner Thornton seconded. And we are adjourned.
All right.
Thank you.
Bye.
Thank you,
Y'all, good
Stephanie.
night.
I'll give you
Good
a quick-
night.
To everybody, and y'all have a good week.
Hey, Melissa, I'm gonna give you a quick call in about 2 minutes, okay?
Okay. Okay.
Okay. share it with you while you're on vacation. It's not that busy. Well, I wanted to share with you, everybody's pretty much so far in the, it's really working on it. We're trying to get there is going. I think we, different varieties. But also, Jean, I want to talk to you. Hook up with Jean. I said, and I didn't want to keep doing it with email. Was on it, and I said, hey, Jean, I'm not sure if you received the risk assessment. I received it. I said, well, I know you're really busy, and notate for you. If you just want to, I can ask you questions you can answer. I can just note. It's smooth, very quick. It is off your list. It's off my list. I'm not completing that thing. Because the audit committee asked for spend an additional month in all of the departments, at all of them. Not completing that. You tell them if they. I'm talking verbatim. I wasn't offended, but I think you just tell them if they want to complete that risk assessment. So I thought what I would do is drafting an email for you. The PDF is a fillable PDF. All you guys do is just click yes, yes. I'm drafting the, or you can just saying, hey Jean, we just had our risk assessment, our audit committee. Will you get this done before the next meeting? Along that line. Unless you have a better idea, but he told me to my face. Basically, I don't respect what you say. I don't respect what you send. Class, I don't. They want it. They need it themselves. It didn't. I'm used to her being so. I mean, it's okay. I'll inform the committee. She said that's fine too. Like, relax, tone down. So it was your call. I just wanted you to know that. If you just between me and you, the overview commission areas where they're just like these areas could why her and she's trying to get involved to help them out. Help them off. What do they want that information for? What do they need that information? Just for no reason. And so they're on. I wanted to run it by you, let you know what's going on, and see how you want to handle it. But she just the request, the chair, just something that we need from all departments, all but yours and the other two. I've actually given an extension. How do you feel about it? Okay. I just couldn't believe it. I was like, oh, I'm not gonna stress out about it. I'll make sure I let them know. I don't want to touch something like it. Exactly. So you can jot it down. I've done this. It's really depressing because they are busy. And it actually helps them with clarifying what we're trying to, what we're trying to understand. Man, you and me both. Me and you both. I'm telling you. I mean, she talks about me, and I know it, and she questions everything, and it's all weird. So, years in our meeting, in our executive, you do this here because when I read it the first time, what do you want to work here for? These people are not going to waste their time. Engages me in the back and forth. Interested. This is your job. Why are you holding back? This is a private diary. What's going on? I just, and I know that it, yeah, I just don't understand her look, why she thinks the way certain things. I totally get it. For her to just judge a person, you just don't.